Welcome to the Treatment Maps interactive website. I'm Thad Harshbarger. I'm a clinical psychologist licensed in Massachusetts with a private practice on Martha's Vineyard. I'm here to tell you about treatment maps and to invite other therapists and researchers to participate in this site. I've been a psychotherapist and psychoanalyst for over 35 years, working in clinics and mostly private practice. During that time, I've become increasingly unhappy with the kinds of resources available to support clinical work. We need all the help we can get, and what we're getting isn't good enough. Psychotherapy is about process and about working with one patient. Standard resources organize theories, diagnoses, and treatments, and lose track of patients and process. With the possible exception of case studies, our resources are about abstractions and group data. Where's the patient? How can these resources help you deal with individuals when their basic units of analysis are groups of people, or summaries of treatments, or collections of ideas? But the situation is actually worse than that. These resources are organized logically. They categorize ideas and findings rather than help you find a way to work with a particular patient. And solutions are grouped into bundles, like encyclopedias do, or like weekly lectures in college. Where's the process? Where do they discuss partial diagnosis, or the relationships among diagnostic choices and treatment options, or treatment planning as a dynamic series of steps? The fact is that most of the resources commonly available are only marginally helpful in working with patients. They're fine for science or education, fine for collections of ideas or group averages, not so helpful with individuals. We need individualized treatment resources that help us select effective interventions for each patient at each stage of therapy. That's what treatment maps are. And because patients differ so much, we need resources that point us in different directions for different patients. That's what treatment maps do. But the problem is, the standard textbooks are already out there, bringing encyclopedias into our working lives. If we're going to have a different kind of resource, we will have to create it ourselves. That's what this site is about. The goal of this site is to have a place where we can share our collective expertise in a form that enhances our individual abilities to organize the process of psychotherapy, to develop resources that address the next step in working with a patient, to give each other ideas without giving directives, to enhance our options and encourage our flexibility.